Human immunodeficiency virus, HIV, is a viral infection that progressively destroys certain white blood cells and can cause acquired immunodeficiency syndrome, AIDS. HIV can be transmitted through unprotected sexual contact with an infected person, injection of contaminated blood, transfer from an infected mother to a child before birth, during birth, or after birth through the mother's milk, medical procedures such as transfusion of blood that contains HIV, procedures done with inadequately sterilized instruments, or transplantation of an infected organ or tissues. Within 1 to 4 weeks of infection, these symptoms may appear, lasting from 3 to 14 days. Fever, rashes, sore throat, swollen lymph nodes, and fatigue. After the first symptoms disappear, most people, even without treatment, have no symptoms or only occasionally have a few mild symptoms. This interval period may last from 2 to 15 years. The symptoms that most commonly occur during this interval include swollen lymph nodes, felt as small, painless lumps in the neck, under the arms, or in the groin, white patches in the mouth due to candidiasis, shingles, diarrhea, fatigue, fever, sometimes with sweating, progressive loss of weight, and anemia. For some people, the first symptoms are those of AIDS. AIDS is defined as the development of very serious opportunistic infections or cancer. These infections cause symptoms depending on which organ is affected. If the lungs are affected, people may experience a fever, cough, or shortness of breath. If the brain is affected, people may experience a headache, weakness, loss of coordination, or deterioration of mental function. If the digestive tract is affected, people may experience pain in that area, diarrhea, or bleeding. To diagnose HIV, doctors do tests to detect antibodies to the HIV virus in a sample of blood or saliva, or tests to detect HIV RNA in a sample of blood. Strategies for preventing the transmission of HIV include abstaining from sexual activity, using a latex condom for each act of intercourse with an infected partner or a partner whose HIV status is unknown, getting tested for HIV and other STDs before engaging in unprotected sexual intercourse, and never sharing needles or syringes. HIV can also be prevented by wearing rubber gloves when touching body fluids of a person who might be infected with HIV. For men, circumcision reduces the risk of being infected with HIV during vaginal sex with an infected woman. And for men engaging in oral sex, withdrawing before ejaculation can also be a preventative measure. Treatment with antiretroviral drugs is recommended for almost all people with HIV infection because without treatment, HIV infection can lead to serious complications, and because newer, less toxic drugs have been developed. Additionally, treatment can include drugs to prevent opportunistic infections and drugs to relieve symptoms.